This small study investigated the dispositional humility of clinicians working in integrated primary care clinics and asked the question, can the concept of humility be identified as an important factor to enhance interprofessional collaboration? Aim 1 involved quantitative survey questionnaires, and Aim 2 involved interviews and analysis of qualitative data. The concealment of the aim addressing humility was an important part of the research design. 32 individuals accessed the survey and 21 participated. 14 out of the 21 individuals who took the personality test and attitude questionnaire completed an interview. During this process, one clinician contacted the study PI directly and was included in the study per protocol. Summative coding and directed content analysis were performed accordingly. Directed content analysis looked for preconceived codes specific to an existing model. The Z-score diagram describes a perfect hexagon for the standardized norm for college-level subjects as seen with the yellow line. The combined 21 clinicians' characteristics showed statistically higher levels of honesty, humility, conscientiousness, and openness domains. Integrative medicine attitude questionnaire showed no statistical difference between different types of clinicians. The summative coding table describes the number of individuals who mentioned a particular code out of 15 total individuals. For example, 13 out of 15 clinicians mentioned patient-centeredness as an important environmental factor, and 11 out of 15 clinicians mentioned friendliness or approachability as an important dispositional factor, and so on. This study used the previously published concept map for the directed content analysis to search for the codes or themes and modified the map based on the data. The grayscale indicates the codes or themes that did not emerge. For example, in the attributes of dispositional humility, open to new ideas and appreciate the contribution of others were detected. However, the themes related to accurate self-assessment and developing generosity did not emerge. Participants mentioned a busy schedule, which can lead to loss of humility and a sense of self-importance. Participants tended to notice attributes related to the loss of humility, such as egotistic, arrogant, dogmatic, overconfident, selfish, inflexible, and narrow-minded. The importance of professional training, commitment, and development of a respectful work culture was mentioned, as well as the story of an overconfident resident being reproached by a supervisor leading to a reality check or humbling moment. In addition to the reality check or humbling moment, having time for positive social activities and fostering mutual learning can also promote a sense of self-awareness leading to humility. Some of the consequences of having dispositional humility include respecting fairness and equality and providing a safe and encouraging environment, which leads to well-functioning collaborations. By incorporating these inputs, the original concept map was revised. Primary care clinicians perceive the characteristics of humility in others to be beneficial to well-functioning collaborations. Understanding the capacities of colleagues with different professional backgrounds and training, having a strong sense of commitment to one's profession, having positive social activities that promote mutual learning and respect, in lieu of providing humbling moments, all appear to contribute to well-functioning collaborations. Possible future studies include a sensitivity analysis to test the robustness of the model, and outcomes research on the relationship between the clinician's dispositional humility and outcomes of patients not only with respect to biomedical measurements, but also the measurement of patient empowerment, leading to the tendency towards self-care and self-management of diseases. Thank you very much for your interest in this article.